Richard Kluche with you. Good to have you with us this Thursday evening on 680 CJOB.
I am Katie Hursh. I am the board chair of the Health Sciences Center Foundation Board of Directors. In my day job, I'm vice president at the McGill-Stevenson Company Limited, and I have 3 young children at home. So a lot of my day is consumed, as it should be, with the 3 of them.
So you play zone, right?
I do. When we had our third, we realized that we were moving from man to man right into zone. And I can't say it's a very good zone many, many days.
A $1 million announcement.
Yeah. So, Richard, we were absolutely thrilled to have Canada Life announce that they are committing a $1 million donation to the Health Sciences Center Foundation's Operation Excellence campaign. Certainly, we are just absolutely overwhelmed and grateful for the financial support, but just as much the very public endorsement of the work that the foundation is working on. We know as Winnipeggers that Canada Life occupies such an important part in our community, but the fact is Canada Life plays this role right across the country. And the fact that we have Canada Life coming forward and saying that we believe in and support the work of the foundation is such an energizing motivator for us to continue to do what we're working on over there, to continue to do what we can to help drive innovation at the hospital and to really build upon the momentum, none of which, of course, would be possible without the donations of our donors like Canada Life.
$1 million really moves the needle.
That it does.
And so where did the dollars go? How are they used?
So this donation is in support of our Operation Excellence campaign, which is our transformative $108 million campaign that we've been running for a couple of years now in partnership with the province. And really what it's designed to do is end our surgical wait lists at HSC by 2030. It's doing that by investing in our state-of-the-art technologies, minimally invasive surgical technologies, building out our surgical bed capacity and our recovery bed capacity in the hospital. All of that is designed to really tick away at those wait lists. And we're making real progress. We've invested $40 million to date in all of those types of things. Really, a perfect example would be our recent acquisition of Manitoba's first surgical robot that came on board in September of 2024. And we are seeing such vastly improved outcomes for our patients. So this donation from Canada Life is going to go to continuing to fund things like that.
The outcomes of patients, not only a lot better, they're spending less time in hospital. You're able to reach out to even more patients as well. It's win, win, win. And the whole fund, the whole existence of this is not only driving innovation, it is really driving the future of healthcare at HSC.
It certainly is. And I have to say, I've had the really amazing opportunity to see that robot in action in a number of surgeries now. And it's truly awe-inspiring. When you can see our surgeons leverage this technology to be able to make these very precise and minimally invasive incisions and then operate the robot from a console that is across the room, we are having such vastly improved patient outcomes. As you say, faster recoveries. They're going home in many cases the next day, some cases the very same day. And again, as you said, we're being able to reach patients that previously would not have been eligible for conventional surgeries a year ago. So you think about the difference that this is making on those patients' lives, their loved ones' lives, these vastly improved and positive alternatives. And it's as a result of investing in technology. And it's being done because of donors like Canada Life that are stepping up.
Well, and it's also attracting the best and the brightest here. We are not only keeping our doctors that want to get into this, we're attracting them from elsewhere. And that to me is also appealing as we continue to invest in this. How long have you been active on the board here? You're chair now, but there's a bit of a backstory to this as well.
I do. So it's been a couple of months that I've been chair, but have been on the board for 6 years now. Although my journey, let's say, with fundraising for healthcare certainly started well before that. My mom was diagnosed with breast cancer when I was 19 years old. And to say that was a devastating diagnosis, you can't really touch on. But what my family was absolutely struck by was the way that our community rallied around us during that time. And that was despite the fact that we had moved to Winnipeg only 5 years prior. But we had people reaching out in the most thoughtful and loving ways to try and offer support. And what we came to realize is that people wanted to do something. And so my 3 siblings and I was the eldest of the 4 of us, decided that we were going to try and channel that support into something really tangible. And so we started fundraising for cancer treatment and research at the time by doing fundraising walks, by hosting pink parties at our family's house, really trying to get our friends, all of them who were young, to rally around this cause. And people stepped up. And I think what I realized at a very young age was that people are able to unite around something as unifying as a healthcare or health diagnosis, because it's such a common lived experience. And it's one that all of us are going to face either ourselves or with our family members at some time in our lives. And so it became a very easy thing to try and start championing is really getting people to get involved in proactively trying to improve healthcare. So when the opportunity came to join the HSC Foundation board in 2019, many years later, it just felt like such a natural evolution of the role that I had already been playing for so many years. And certainly my commitment and my energy for the work that we're doing at the foundation only continues to grow, as I have been so fortunate to be able to be at the front lines of hearing so many of the successful patient stories that we are privy to as a result of the investments in our innovation and our technology and our people that the foundation is able to make, again, because we have such positive support from our donors.
Yeah, and on those darkest days, you can go back and say and remember those conversations that you had with family and mom about how you channel this. There's one thing to be and maybe to spend a few hours, a few days being negative, but how do you channel this into something positive, and how you recommit your life towards that? And it's good for the heart and the soul and everybody around you, because that positive energy also brings positive energy as well. And that in itself is healing.
I completely agree. And that was certainly our experience. And if there's anything that I can now do, having learned that lesson, again, at a fairly young age, to be able to help others going through something similar, then I'm all here for it.
This is a powerful board. And I mean, there's a nice cross-section of people here that are committed to not only HSC, but to this city and to this province. And so as you step up a chair, big shoes to fill. I remember you saying that about your predecessor as well. Yet you also want to make your mark. So as you start to kind of get into this, what are your thoughts about what's next?
Well, you're totally right. And I would be remiss to not, again, thank Tina Jones for her leadership of the foundation for 10 years. And I felt so fortunate to have had 6 of those years being able to learn from her, so that I felt very ready when the time came to take over, knowing all the while that I was so wonderfully supported by everybody else, staff and board members alike, that make up this wonderful family that is the foundation. So when I now look to the future, and I think that there's an opportunity to build on so much of what we've already done. Our commitment to being an innovation driver, to sourcing and acquiring new technology, is really going to continue on as we move forward here, because that's where we can move the needle so directly in the delivery of healthcare, but also keeping our eyes alive to what else is next. It's such a rapidly changing environment, especially when we talk about technology, that we have to be able to be nimble to respond to those things. And we are fortunate to have such great partnerships with Shared Health, with our healthcare providers at HSC, where we are hearing from those frontline people what they are seeing and what they're needing. And we have a really fantastic base of donors that are responsive to those needs. And so we have this perfect marriage of opportunity in front of us. And I just feel so fortunate to be a part of it.
Well, and you're not only leading on the excellence side, the steps forward, and we see this across the province, is infrastructure renewal. It's an old campus at Health Sciences Center. So as you look forward to the future, there's those opportunities, not only to fill the technology gap, to get more doctors, physicians, to increase and speed up the patient experience, but there's also some crumbling buildings there. So there's plenty of work to be done in the years ahead.
We are not going to be resting, I can assure you that.
Thank you so very much. Great to meet you.
Wonderful to see you. Thanks.
Katie Hall Hursh joining us on 680 CJOB, the new chair of the Health Sciences Center Research Foundation. I'm Richard Cloutier. This is Newsnight.